The pandemic has highlighted a number of challenges in healthcare and in healthcare systems. And one of the most affected spaces is in residential care and in elder care. People living with dementia had a 40% mortality rate if they were infected with COVID. And so, quite right, we were all very careful about exposing older patients, in particular older people with dementia, to this very deadly virus, especially early on. Residential care facilities have always had their own sets of challenges. It's residential care, but it's hard to make it feel like a residence, for example. People have all kinds of visions about what really happens inside of facilities. Families who've experienced it, of course, have their own lived experience. And of course, quality varies widely at different levels of care in facilities, everything from senior living communities to skilled care. In terms of people living with dementia, which make up the vast majority of residents in an institutional setting, there has always been a high rate of neuropsychiatric symptoms. It's very difficult to identify exactly what might be driving it because they tend to be advanced stages of illness. They're the least likely to be able to express what they're feeling, what they're thinking, how they're interpreting the space around them, which may look very different than what they're used to. In the case of the pandemic, when really you were down to staff and residents and so many mandates that kept us away from one another, everyone felt the lack of intimacy and connection with other humans. And envision that you are in advanced dementia and your connection with other humans largely comes from touch. It comes from sensation. So your senses, right? So your vision. And what you're seeing is not the person's full face, but a mask. And your touch, and we're keeping mostly distance away from one another, 6 feet, right? We isolated people when they came down with the virus. And social isolation, when it's self-imposed, is already very dangerous to someone's neuropsychiatric symptom burden. Imposed isolation could not be better. So the challenges in institutional settings were just so many factors played into that. And I should add that families were not part of the care because they had to stay out. Even if they were vaccinated, many times could not come and be part of this person's care. And in reality, family caregivers are still the bulk of caregiving in dementia in this country, including when someone is in a residential care facility. And so now we've reduced staff, reduced the available workforce, which was already strained for people living with dementia. We've likely exacerbated their symptoms in the name of keeping them physically safe. And I'm not saying I have the right answer. It was just a challenging time to be part of that. And so we also then did see an increased use of medications.